The pollsters say a majority of Canadians support liberalized laws around euthanasia and the right to die. The assisted suicide debate is complex, intense, and polarizing, as you know. In the Netherlands, they have mobile euthanasia units. In Canada, not even on the radar or on the roads. Dr. Romayne Gallagher is a UBC clinical professor in the Division of Palliative Care. She is a family physician who often participates in end-of-life care discussions. And it is my pleasure to welcome Dr. Romayne Gallagher back to Studio 4 to tell us more about a topic we could discuss for days.
Absolutely. Thank you for having me.
So, right to die, euthanasia, how do you define it?
Well, euthanasia, I think we really need to be clear about what we're talking about, because many people are confused, and I think that's often why it appears there's a lot of support for this. Euthanasia is giving someone a substance with the sole intention of ending their life. And that's quite different from withdrawal of treatment when someone has a terminal illness and it's decided that intervention is no longer benefiting them and the treatment is stopped in order to allow natural death to occur.
Okay, and as you know, we all have the right to die. I can stop eating tomorrow.
Of course.
Euthanasia, that's the thorny one.
It is, because it's very, very complicated. I mean, I've met lots of people who say to me, I just want to die. Can you help me get it over with? And in talking with them, what I find is that they just don't want to live like they're currently living, and they see no other option.
Well, any of us who have experienced that with a loved one know what that's like, and they beg you, just let me go,
right,
or kill me.
People are suffering.
Get rid of me.
People are suffering. I think it's very necessary that a healthcare professional explores at length what that statement means, rather than just take it at face value, because you could say, oh, okay, they want to be killed and everybody has the right to make their own decisions. But I found many people who just saw no other option, and when we got their symptoms controlled, or when we helped them to explore new meaning to what they were experiencing, upon asking them again, they said, oh, no, I didn't really mean that. I just felt like I couldn't handle what was going on.
A new way of living while dying.
Right, and people will say to you, well, what does dying feel like? I feel like I'm still living. In fact, my own mother said that to me. When she was dying, she said, well, what's this supposed to feel like? I feel like I'm still living.
Right. Remember Timothy Leary,
well,
who said, can't wait to do it. Haven't done it before.
Yeah.
Curiosity. So what is different in the Netherlands or Oregon or Switzerland or Belgium about euthanasia? I can't lump those all together, but say Switzerland. I have heard of people who want to go, and they go to Switzerland and can go through the whole process because it's legal, they say.
Right. What's different from here? I guess it's just that the people have decided that they can legally allow that. I have grave concerns about that because of the people I've met who were just looking for a different way to live, not die, because it's complicated making decisions when you're under stress, and being ill, being sick is very stressful, and it's well known that people don't make the best decisions when they're sick.
I had a friend who was an HIV/AIDS activist, and he got full-blown AIDS, and he had worked with so many people who had died from AIDS. He knew what was going to happen. He knew his brain would eventually not work, and so it was his desire to make a decision before he got to where he knew he was going. Now, by a miracle, maybe he wouldn't have gone there.
Maybe.
Not sure.
I mean, I think people have more choices than they realize. So you always have the choice to refuse treatment. So people say, well, I don't, you know, if I get dementia, I don't want to live to the point where I don't recognize anybody or I'm just lying immobile in a bed. Well, you have the choice that if some infection comes up or something like that, you don't have to have that treated.
You can say no heroics. What's the term?
Well, that's the problem with the term no heroics is, and I've looked at living wills like that and thought, oh, what does this mean?
Right. I think that's what mine says.
Yeah, well, I think you're better to actually have somebody who knows you and knows your values, knows what gives meaning to your life, and kind of has a sense of how you look at life, so that given the certain medical circumstances and the choices, they could say, well, you know, Fanny wouldn't go for that, or Fanny would go for that. And that's probably a little bit better than something you've written when you were well. Okay, because people's minds change over time. As one person said, as he got sicker, at first he wanted the whole farm, and then he said as he got sicker he was settling for the barn, and then as he got even sicker he was settling even for just a piece of the backyard, meaning that life, we find some way to live and find meaning. Most people are phenomenal in how they can learn to cope with losses, right?
Very much so.
And they find that they don't want to let go that easily. And to me, that's why this whole focus on right to die, most people actually just want to live. Because if you look at the stats for the number of people, for instance, in Oregon that have chosen to take advantage of the assisted death legislation, it's about 1 to 2 deaths per 1,000.
It's called assisted death legislation, and it gives you what option?
It gives you the option to have a prescription which, when taken, will cause death.
Taken by yourself?
Yes.
Or administered by someone else?
Well, that's where it gets kind of tricky. And but usually physician-assisted suicide means that you take the pills yourself.
Okay, and if a doctor, is there a country where the doctor is allowed to inject you with a substance?
Yes, and that's the Netherlands.
That's the Netherlands. So if you desire, and you have to be mentally competent, and that can be difficult to determine.
That gets extremely difficult, because if you actually look at the rates of euthanasia and physician-assisted suicide between the Netherlands and between Oregon, there's a dramatic difference.
Okay.
So in the Netherlands, you know, the studies talk about, well, we estimate the prevalence or the number of percentage of deaths to be about 2.7%. In Oregon, as I said, it's about 1 to 2 per 1,000. So you're looking at 0.2% versus 2.7%. Now that's a huge difference.
Certainly. Well, as you know, because you work so much in palliative care, nobody wants to die in unspeakable pain.
Absolutely.
Or agonize until their last breath. And today it seems we have the miracle drugs and certainly the competence to keep you comfortable.
We do, and I think this should be the real focus, I think, of the public awareness and demand should be for better end-of-life care, because if I went to a bus stop here or anywhere, I could come across someone who says, yeah, I know somebody and things didn't go so well, and it frightens people, because we're all frightened of the process of dying. So what I think we really need to focus on is getting access to quality, standardized palliative care, which is not all about dying, but helps people to live as well as they can for as long as they can, and to have a better quality death.
Absolutely. Values the person, and the nurses are marvelous in palliative care, I think, because they help the family so much, and they know the stages of death, and certainly nobody knows when anyone's going to die, but they explain to you what is happening physically to the body, if not spiritually to the body, as you know. What about somebody who has, and there have been certainly test cases, a disease like ALS, Lou Gehrig's disease, knows that eventually their body will...
It's incredibly challenging because I think you gradually lose every function that you had. There is some talk that many people do get impairment in their thinking and that, but for the most part people don't, and I think that's what they find the most challenging, is how to adapt to the gradual loss of all your body functions. So incredibly challenging.
With a keen mind.
Generally
often,
with a keen mind.
So you have a Stephen Hawking mind and a body that doesn't work.
You know, it's interesting. Have you ever read Viktor Frankl's Man's Search for Meaning?
One of the best books ever.
Yes, and I highly recommend that everybody read it. It's a short book. And he talks about the people who'd lost their freedom. Essentially, they had lost huge, the freedom, what they could do, what they could eat, etc. But they never lost the freedom to respond to the way they were being treated. And what he really pointed out is everybody has a choice in how they respond to the challenges that they're given.
Yes.
And that's so true. And you can see people who grow marvelously, both spiritually and emotionally, right up to the time of their death.
Yes, very much so. I've had a couple of health challenges, and I know what that's like, because you don't know how you will respond. And you're a bit surprised at yourself.
Yeah, and I think
often.
And I think I could ask, I'm always amazed, I can ask people where the most dreadful things have happened to them. Is there something good that's come out of this? Almost, I think no one has said to me, no, there's not a damn thing.
Right.
Most people could say, yes, actually, I can count this, or I now see this or that. I mean, human beings are remarkable.
I've talked to paraplegics, quadriplegics over the years who have said, I hate to tell you that this chair was a gift. But in a way it was, and it's always amazing and astounding. So to make a clear decision on this about how we feel, if we do ever vote on it, what question to ask?
I think we have, there's multiple questions to ask. I think first people need to know their rights as a patient, so they have the right to refuse treatment, they have the right to stop treatment partway through, to withdraw from treatment. They have the right to say, no, I don't want anything, even if it's going to result in their death. They have the right to do that. And they have the right to change their mind about that any time as well. They also have the right to appoint someone to speak for them when they're not able to. And I would encourage everybody to do that, because I think there's not enough discussion about those kind of things beforehand.
Well, as you said earlier, it's the last taboo. 100% chance we'll do it.
Oh, indeed. Life is 100% fatal.
Yes, 100% fatal. I thank you.
You're welcome.
Thank you.
Thanks for having me.
Dr. Romayne Gallagher, family physician, clinical professor in palliative care at UBC.